Call the meeting to order. We'll begin with a moment of silent prayer and then the pledge. Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Okay, to begin the proceedings today, I'm going to spot out the brand new supervisors. Would you please stand when I call your name? Supervisor District 2, Joseph Vispalek. Linda Gurath, who is attending remotely, District 4. District 5, Randy Marquardt. District 7, John Chodron. District 9, Kara Guzzi. District 11, Doug Newman. District 15 is Pamela Conrath, who is also attending remotely. District 16, Louise Kruger Gundrum. Lois, sorry. Already I made a mistake. District 19, Todd Boltman. District 20, Jeff Milliken. Welcome, everybody. Thank you. Okay, the affidavit of posting. This is a meeting of the Washington County Board of Supervisors. Prior to this meeting, public notice was given by posting a copy of the agenda in the office of the county clerk and emailing the agenda to the West Bend Daily News, which is the official newspaper. In addition, the agenda was emailed to CNI newspapers, Express News, the Kewaskum Statesman, the Milwaukee Journal Sentinel, WIBD, WMBZ Radio, and WTKM Radio. This above action is in conformity with the state of Wisconsin's open meeting law. We'll begin next with the administration of oath of office by county clerk. Everyone will need to stand for this.
I'm actually going to do the roll call first.
Oh, you're going to do roll call, sorry, roll call.
Okay.
Roll call vote, begin, sorry.
When I say your last name, please just say here or yes. Dice? Here. Vispalek?
Here.
Bossert?
Here.
Gurath?
She's here remotely.
She's on.
Linda?
Oh, yes, here. Okay. Marquardt?
Here.
Kelly?
Here.
Chudron?
Here.
Krebs?
Present.
Guzzi? Here. Samisek?
Here.
Newman?
Here.
Gonring?
Here.
Hartwig?
Here.
Bishop? Here. Conrad? Here. Gundrum? Krieger Gundrum? Here. Mahalik?
Here.
Berg?
Here.
Boltman?
Here.
Milliken?
Here.
Creefall?
Here.
Brandner?
Here.
Gallitz?
Here.
Sorcy?
Here.
Schleif?
Here.
Marion?
Here. I'm just going to give some instruction to the people on the video. I have you muted. If you have questions during the meeting, unmute or raise your hand so I can see you. That way I can tell Don he can't see you because you're behind him. So if you unmute, I can see that you're trying to chime in. Also, just raise your hand if we don't get to you.
Okay, the administration of oath of office by county clerk.
Okay, so I'm going to have you all stand, and you'll all just raise your right hand, and you'll repeat after me. So you'll have to, in your folder, just so you know, there are 2 copies of the oaths. I will need 1 of those. So if you can please sign both copies after I administer the oath. After the meeting, we can pick those up from you. Just make sure you leave 1 on your desk. Okay, just repeat after me. Please state your name.
Donald Creefall.
Having been elected to the office of Washington County Board Supervisor.
Having been elected to the office of Washington County Board Supervisor.
And then please state your district.
District 21.
Swear that I will support the Constitution of the United States.
Swear that I will support the Constitution of the United States.
And the Constitution of the State of Wisconsin.
And the Constitution of the State of Wisconsin.
And will faithfully and impartially discharge the duties of said office.
And will faithfully and impartially discharge the duties of said office.
To the best of my ability, so help me God.
To the best of my ability, so help me God.
Thank you. Please sign your copies. And then I will just read the certification. I, Ashley Riker, County Clerk, and for the County of Washington, Wisconsin, do hereby certify that the following is a true and correct list of members elected to the Washington County Board of Supervisors as certified by the Board of Canvassers of Washington County. Supervisory District 1, Christine Dice. 2, Joseph Asalik. 3, Chris Bossert. 4, Linda Gura. 5, Randy Marquardt. 6, Dennis Telling. 7, John Chodron. 8, Brian Krebs. 9, Kara Guzzi. 10, William Samisek. 11, Doug Newman. 12, Joseph Gonring. 13, Robert Hartwig. 14, Marcella Bishop. 15, Pamela Conrad. 16, Lois Krieger Gundrum. 17, Timothy Mahalik. 18, James Berg. 19, Todd Bultman. 20, Jeff Milliken. 21, Donald Creefall. 22, Rock Brandner. 23, Brian Gallitz. 24, Peter Sorcy. 25, Jeffrey Schleif. And 26, Carol Mary.
Okay, next is the adoption of rules of order, 15-6, Washington County Code. Need a motion? Supervisor Krebs, Supervisor Bossert, I want to make a little statement before we go to the vote. In order to allow for a more robust debate on the floor of the county board meetings, I would strongly suggest that supervisors respectfully limit questions or comments to 2 per call-in. Far too often, supervisors with a long list of questions limited the participation of other supervisors. I would recommend that any supervisors with questions first consider contacting department heads, committee chairs, the county executive, the county attorney, or the board chair to gather pertinent information surrounding those questions that may or may not be necessary for floor debate. After all other supervisors have had an opportunity for input, those supervisors with additional unanswered question or comments may do so. I do this to respect everyone's participation in the debate. Thank you. Is there any discussion regarding the adoption of rules? Seeing none, vote. All in favor, signify by saying aye. Aye. Any opposed? Any abstentions? Next, we'll begin with election of chairperson and first vice chairperson. We'll begin with the chairperson. Do I have any nominations? Supervisor Mary?
Thank you, Chairman Creefall.
Can we wait for get the microphone over, please?
I can yell loudly if that's.
Well, yeah, they won't be able to hear you on the remote,
That's fine.
so.
Thank you. This is an extraordinary time for all of us as defined just by our meeting here this morning. It is also a totally unique time for the government of Washington County as we embark on a completely new management course with the county executive. For all these reasons, I encourage us to continue with the leadership that has seen us through the past 2 years and is in place to manage the challenges we face right now and into the future. With all that in mind, I nominate Don Creefall for the position of chair of the Washington County Board.
Thank you. We don't need a second, but thank you, Frederick. Are there any other nominations? If there's no other nomination, do I ask for unanimous consent? Entertain a motion for unanimous consent. Supervisor Schleif, Supervisor Brandner. And we still have to go aye. All in favor, signify by saying aye. Aye. Any opposed? Any abstentions? Thank you. Thank you very much. You could discard the red. Yeah, you don't need to do it. It was unanimous consent, so. Entertain motions for County Board First Vice Chairperson. Supervisor Smisek.
I'd like to nominate Dennis Kelly.
I'll second it.
We don't need a second, but thank you. Supervisor Hartwig.
I'd like to nominate Peter Sorcy.
Okay, we don't need a second. Any other nominations? Are there any other nominations?
Excuse me, this is Pam. I didn't
thank you. The second nomination?
Oh, the second nomination was for Peter Sorcy.
Okay, thank you.
Okay, your official ballot for the first vice chairperson is canary yellow. So, print the name. Sorry.
Is anybody going to get up to talk? Or just-
If you would like to,
I'm just saying.
would you, if you want to stand up and talk, Mr. Sorcy, Supervisor Sorcy, go ahead.
Microphone.
You need a
Been on
microphone.
the board for the last,
The people remotely can't hear you unless you have a microphone.
oh, okay. I still have you grab Josh. Hi, I'm Pete Sorcy. I've been on the board for the last 12 years. I'm active in state committees, about 7 or 8 to be exact. I know everybody from the Supreme Court on down. I have been around the corner for a long, long time, and it would be an honor for me to serve as a vice chair and use my talents and people that I know. So I would appreciate your vote. Thank you.
Supervisor Kelly, would you like to speak?
No, thank you, sir.
Okay. All right. Use your canary yellow. Please print the name of the candidate that you're supporting, and then fold the thing, and the clerks will come around to collect. Get her on the way back.
This is a faulty election.
Yeah, I'm going to protest the results of this election.
Yeah, there's no, we're in cigar boxes. Oh, she took them?
That was worth money on
My favorite part. Get down. How do the people online vote? Can you?
They're emailing me,
They're emailing to the clerk.
but can you remind them because I have.
Yes, people that are attending remotely, please place your vote via email to the county clerk. Do I need to read your?
Why don't you?
Ashley.reichert@county.co.washington.wi.us. Let me know when you receive those votes.
Can you ask them if they've sent their vote? Is that having?
Linda, have you sent your vote in? Is she muted still?
Linda, now you can talk, Linda.
Linda? Garath? Supervisor Garath?
Yeah, I just sent it.
Okay, thank you. Supervisor Conrath?
Mine should be coming, yep.
Okay, thank you. It is a new world.
Someday computers will roll.
Yeah. How we doing?
Haven't gotten-
Nothing?
Yeah.
Yeah, it should pop up, if they're doing it on,
They don't have their,
oh, they don't have that.
no.
Oh. Do you have yours on,
I'm gonna call them outside and call it.
I'll,
Do you want to, Ethan?
yeah, call them and have them text it in then. That'll work.
hold on, I gotta, if we're gonna give your phone number, I gotta turn the live stream audio off.
Okay.
Okay. Are you gonna email them? Your phone number.
I don't know what their personal emails are.
Then just give it to them, or give the audio on the live stream to them.
Yeah.
So you can just give them your cell phone.
Sam and Linda, can you just call me at 262-357-1206?
Can't call you simultaneously.
Yeah, I don't have their emails, because they're their personal emails. You have what?
Please repeat that phone number
Yep.
again.
262-357-1206.
Huh? Yeah.
Thank you.
Yep.
That's too.
May I just-
And you want us to text
You can just call me.
or call?
Yeah.
Okay.
I just-
Oh, I just sent a text.
Oh.
920
You want me to answer it on speaker?
627.
Or it's
It's
not?
private.
5932.
Hi, this is Ashley.
Oh, hold on, she's gotta get muted.
She got it.
Okay, now she can say.
Just mute.
Or, hold on.
No, she unmuted herself.
Hold on 1 second.
I'll mute you, Linda, don't worry about it.
Okay. Okay, perfect. Thank you. Bye. Okay, I have to go.
You got both of them now?
I had one. Yeah, the other one just called and said, yeah.
Otherwise, why don't you fill a slip out form so you can.
Do we, I don't have this slip.
She's got two in front of her. Mary.
Two slips, I can use.
Da, 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 da.
Can we read these?
Yep.
Dennis Kelling. Dennis Kelling. Dennis Kelling. Peter Sorcy. Peter Sorcy. Peter Sorcy. Kelling. Kelling. Dennis Kelling. Dennis Kelling. Dennis Kelling. Dennis Kelling. Kelling. Peter Sorcy. Dennis Kelling. Dennis Kelling. Peter Sorcy. Pete Sorcy. Dennis Kelling. Dennis Kelling. Dennis Kelling. Dennis Kelling. Dennis Kelling. Sorcy. Dennis Kelling. And Dennis Kelling.
1970.
Okay, congratulations, Supervisor Kelling, first vice chair.
Thank you, sir.
Next in line, we have Land Use and Planning Committee Chair. That will be your pink ballot. Do I have any nominations? Supervisor Schleif.
I would nominate Carol Mary.
Are there any other nominations? Are there any other nominations? Any other nominations? Hearing none, I'll ask for a vote of unanimous consent. All those in favor, signify.
I thought you were entertaining a motion.
Yeah, we need a.
Oh, I have to do a motion, yeah.
Yeah.
Supervisor Dice,
I would move that the nominations be closed and a unanimous ballot be cast for Supervisor Mary.
Second.
second Bossert. Okay, all in favor, signify by saying aye. Aye. Any opposed? Any abstentions? Congratulations, Supervisor Mary, Chairman of the Land Use and Planning Committee. The next will be the, they call it purple. I don't know, it's lavender or, I don't know. Lilac, I'm sorry, it's lilac. Lilac. For guys. So, for guys, yeah. Then that will be for the Human Services Committee Chairperson. Entertain motions. Supervisor Bossert,
I'll nominate Supervisor Dice.
okay?
I just have a comment. I am in the corner, so I will give you permission to refer to me today as baby if you so choose. However, on your ballot, please write the name Dice, D-E-I-S-S. Thank you.
Yeah. And remember, it's dice, not dice.
That's correct. Thank you.
Okay, are there any other nominations? Are there any other nominations? All right. Supervisor Schleif,
I move the nominations be closed and we make a unanimous decision.
seconded by Supervisor Mahalik. All those in favor, signify by saying aye. Aye. Any opposed? Any? Okay. All right, we're all good. Okay. No abstentions. Okay. Congratulations, Supervisor Dice, Chairperson of the Human Services Committee. You go, baby.
That's only because nobody else wanted it.
All right.
Too intimidated.
Oh, I'm really a sweet old lady.
Oh, we know.
Next online is the Administrative Committee. That will be your orange. Yeah, I think it's salmon to be. Supervisor Kelling.
I'd like to nominate a very conservative, fine gentleman from the obvious city of Hartford, Mr. Mayor Tim Mahalik.
Thank you. Are there any other nominations? Are there any other nominations? Entertain a motion for unanimous consent. Supervisor Kelling, seconded by Supervisor Smisek. All in favor signify by saying aye. Aye. Any opposed? Any abstentions? Seeing none. Congratulations, Supervisor Mahalik. He's the man behind the mask, practicing good PPE for our COVID coronavirus.
I call it, well, the
The Wuhan coronavirus. There you go. Thank you. Next is public safety. That would be the tan one. I think I'd go with tan on that. If no other. Entertain motion. Supervisor Kelling.
I would like to nominate a friend, and sometimes the only person that I've been able to talk to for the last 4 years on certain issues. A man who's always been there for me when I needed him for guidance and suggestion. I'd like to nominate Chris Bossert for Public Safety Chairperson.
Okay. Do you have any other nominations? Supervisor Sorcy?
I nominate Joe Gonery.
Okay. Any other nominations? Okay. Any other nominations? Seeing none, we'll vote. Please print, and also you need to print your name on these ballots. So print on the top is your candidate, on the bottom is your name.
sheriff brown color.
Yeah, it's the tan. It says tan on here. I'm going to go with that one.
Ashley, answer your phone. Well, I guess it could be other hours.
Did I miss anybody?
Right here.
Thank you.
Our remotes are in.
Yes. You ready, Ethan?
Yep.
Tim Mahalik. Chris Bassard. Joe Gunring. Joe Gunring. Chris Bassard. Chris Bassard. Chris Bassard. Chris Bassard. Joe Gunring. Joe Gunring. Chris Bassard. Chris Bassard. Chris Bassard. Joe Gunring. Joe Gunring. Chris Bassard. Chris Bassard. Bassard. Chris Bassard. Chris Bassard. Gunring. Chris Bassard. Chris Bassard. Bassard. Bassard and Bassard.
Thank you for that screen.
Congratulations, Chris Bossart, Chairperson of the Public Safety Committee. Last but not least, well, not last, but last of the committee assignments is Public Works. That is your green ballot. Entertain Supervisor Mary.
Yes, sir, I nominate my colleague from Germantown, Supervisor Schleich.
Thank you. Supervisor Bishop.
I nominate Bob Hartwick.
Okay, Bob Hartwig. Are there any other nominations? Are there any nominations? Okay, we'll vote on this one. It's the same as the last. Print the name of the candidate on top. And print your name on the bottom.
Hello? Thank you.
I missed the cigar box. Yeah, probably Fernald. I bet you Fernald's got a wood one.
Yep.
Do we have everyone's green sheet? Schleich. Jeff Schleich. Bob Hartwig. Hartwig. Jeffrey Schleich. Jeff Schleich. Jeffrey Schleich. Jeffrey Schleich. Bob Hartwig. Bob Hartwig. Bob Hartwig. Schleip. Jeff Schleip. Jeff Schleip. Jeff Schleip. Jeffrey Schleip. Jeffrey Schleip. Jeffrey Schleip. Bob Hartwig. Jeff Schleip. Hartwig. Jeff Schleip. Schleip. Bob Hartwig. Jeff Schleip. And Schleip.
Congratulations, Supervisor Schleif, Chairman of the Public Works Committee. Okay, the last is the election of the second vice chairperson, which is a gray ballot. That will be among the chairpersons of the standing committees. Ashley, could you just say which ones are the standing committee chairs? Do you have that? Just so it's announced.
Yes. Administrative was Tim Mahalik. Public safety was Chris Bossert.
Human Services, Chris?
Human services was Chris Dice. Ethan, can you put these up?
They're up.
Oh, they are up. Oh, okay. Public works was Jeff Schleif. And land use was Carol Neri.
And
Correct?
public safety was?
I said no.
Oh, you did, okay. All right. Okay, so those are the candidates to choose from. One of the standing chairs persons. And just print the name of your choice.
Do we want to take nominations?
Oh, no, there are no nominations.
Okay.
Do we,
Unless somebody
Wait
wants
a
to
minute.
move an unanimous ballot.
yeah, Brad, do I need to take, we don't take nominations for that, correct?
The election is conducted in accordance with how you can elect for chair, so you would take nominations.
Okay, all right, we can't accept nominations. Supervisor Mahalik.
Well, I was going to move for Supervisor Dice, but see, I can't.
Yes, you can.
I can?
You can.
Oh, okay, I'd move for a unanimous ballot for Supervisor
Okay,
Dice.
perfect. Thank
Second.
Okay. Are there any other nominations? Seeing none, we'll vote for unanimous consent. All in favor?
you. Oh, wait.
What?
Someone called and voted for somebody else. I mean, so.
Oh.
you might wanna-
Okay,
Right, who was the unanimous consent for?
Chris Dice?
Oh, never mind.
That was it.
Sorry, I was on the phone, I didn't.
Okay,
Yep.
yeah, growing pains. Okay, unanimous consent for Chris Dice as second vice chair. All those in favor, signify by saying aye. Aye. Any opposed? Any abstentions? Seeing none? Okay. Congratulations, Chris. Good. I don't think you said it was okay to say baby on this one, no? I said it was the last one.
Yelling in the corner now?
Oh, okay. Okay, our next meeting date is Wednesday, May 13th, 2020, 6 o'clock PM.
No, he's in order,
Yeah. We've got something else?
and then we have the.
Yeah, I know.
Keep
Yeah.
reading the agenda.
Yeah, yeah. And communication from the county executive.
Well, thank you. Congratulations to all of you for your election to the office, and to the folks on the executive committee. Congratulations to you as well. This will be a new item on every agenda for those of you who've been here for a while. We will have communications from the county executive on every agenda moving forward. This particular month, we wanted to start it early. Now that you've had a chance to applaud one another for winning and getting onto executive committee, now we'll talk about real work. And so the big news, of course, the reason we're in this room, the reason we're having folks come through the internet is COVID-19. And so I've asked our public health officer, Kirsten Johnson, to come and give a little bit of a briefing on a plan that her team has been working on and our team in conjunction with the Joint Health Department. For those of you who aren't familiar, and I know there's folks watching both online and West Bend Community Television, Washington County has a joint health department between Washington and Ozaukee counties. Kirsten has been the public health director, public health officer of that joint department since our inception about 4.5 years ago or so. And so this is really a plan from the joint health department. It's fully endorsed by myself, and we've been working as an incident command team here in Washington County very closely over the course of the last 6 or so weeks. And so I'll just let her get right into both an executive summary, kind of a high level. We'll do some Q&A. I'm assuming most of you will have questions, and we'll talk just a little bit about what some of the next steps are. What you're going to hear in the next few minutes is really a plan that applies specifically to Washington and Ozaukee County. The language in the plan really is holistic, but we recognize that the condition here in Washington and Ozaukee County is different than Barron County or Price County or really anywhere else in the country. So I'll let Kirsten take it from here, and I'm sure I'll jump in. And as you have questions, please raise your hand and I'll bring you a microphone.
Good morning. As Josh mentioned, my name is Kirsten Johnson. I've been the director of the health department for almost 5 years in Washington County. So as you all know, we've been handling the COVID-19 response from both counties, Washington and Ozaukee. We currently in Washington County, this was as of yesterday, have 87 positive cases, and as of this morning, 4 confirmed deaths. Just so you know sort of where we're coming from. In the past 6 weeks since we started this, we've done over 500 contact tracing cases. So those are people who were direct contacts with positive cases that live in our county. So we've done over 500 of those. My staff is fully, all 40 of us are working exclusively on the coronavirus response. So part of that has been a lot of conversations internally. What does this look like currently? How do we respond immediately? And then also, what does this look like in a month or 2 months, 3 months from now for our communities and things that we should be thinking about? So the economy, the social determinants of health, all those, and the public's health, most importantly. But we've been taking those things into consideration and not thinking about any of this in isolation. So part of that has been, over the past week, we developed a plan. AEI, American Enterprise Institute, which is a conservative think tank out of Washington, D.C., published a document probably a little over a week and a half ago, maybe, that outlines some things that they felt, their researchers and scientists felt needed to be in place. When I read that, it really resonated with me because I feel it's the same things that we need to have in place here for us to open our doors fully. Since we drafted our plan last week, the White House came out with another plan that is actually very closely aligned to what we put together. And then yesterday, Governor Evers came out with Badger Bounce Back, which also closely aligns with our plan. The difference is, as Josh mentioned, is our plan is specific to Washington and Ozaukee County, and it has a little more, it's a little more in depth and it has some legs around it in terms of what does this look like specifically for the businesses that are in our communities? What does this look like for our festivals? What does this look like for our schools and our summer camps? Museums, zoos, you name it, Slinger Speedway, we've thought about all of those things. So all of that is in the full document. I think, has it been sent to them? Okay, it will be sent to you today so you can look at that. It is a living document, so none of this is set in stone. The intention, like I said, was really to think critically about what is this going to look like as we open, and so we have something to respond to and to think critically about all of this. So I'm just going to outline what we have sort of four conditions that must be met in order for me as a public health director to feel comfortable with opening the county. The first is 14 days of continuous decrease, so a downward trend of cases and a decrease in hospitalizations. The second is that our hospital capacity and operations are back to near normal. And I can tell you that we have met that in Washington, Ozaukee County, so our hospitals are in a good place. Enough testing capacity to test everyone who needs testing, which we have not met. And then the capacity to do contact tracing and active monitoring on everyone who tests positives, and to have that done within 24 or 48 hours. And we have met that as well. So 2 of the 4 conditions we have met in Washington and Ozaukee County. Now statewide, we know that all those conditions have been met everywhere, which is why, again, this is specific for us. Once all these conditions are met, I think the most important piece for us right now is the access to testing. On Friday, the state relinquished some of those guidelines. So initially, the state had said, they gave guidelines that said to all providers, test only those people who are critically ill, hospitalized, healthcare workers, or first responders. So our clinicians have been messaged this now for over the past 6 weeks. So getting them to change their behavior, I think, is going to be the biggest hurdle. The other piece is that the testing capacity varies widely across the state. So the state lab of hygiene has more capacity, the Milwaukee lab has more capacity. All of our healthcare providers have their own labs internally, but all of them are at a different place. So not that they can't necessarily test all these people. So again, the number one piece for me in immediate policy action is to assure that we can get the testing capacity up and running. The next step, I think we should all be wearing PPE. As you'll notice, I don't have one on now. We are putting out guidance on how to wear PPE and what's appropriate. That should come out today. It'll be on our website. We, as Josh did on Friday, feel that low-risk outdoor recreation, like going to parks, is acceptable, as well as golfing. We feel that businesses can begin internal operations to prepare to reopen with physical distancing. So we know that there's a lot of questions about businesses who currently aren't operating, but they need to bring people in-house to be able to get themselves up and running. We feel like if they're small populations, they continue taking physical distance within their own business, that they can start to do some of that work. Really paramount to all of this is that everyone who is sick must stay home. If anyone has any symptoms, please don't go out into the public. And then finally, to continue to practice good hygiene and sanitation, which we are doing here. So then I have a whole list of secondary actions. Those are the very specific pieces that apply to various sectors of our economy. So in here I have schools, childcare, summer camps, large business, corporations and manufacturing, small business, retail stores, bars, restaurants, coffee shops, barbers, hair, nail salons, tattoo parlors, vulnerable populations as just a category, social gatherings, graduations, parks, beaches, golf courses, outdoor recreation, fitness facilities, large venues, which includes theaters, sporting, places of worship, museums, marinas, and zoos, shared rides, festivals, fairs, concerts, parades, fireworks, business travel, farmers markets, common areas in any setting, so in a business setting. And then just to sort of catch all other considerations could be considered as we move forward and things open. So there's a lot of more detail around each of those things, but those are the categories that we've thought about and how we've laid it out. And I think I'll stop there to entertain questions.
So before we take questions, I just want to point out a couple of things. First, as we saw on Saturday down in Brookfield, there's clearly an appetite for people to start opening the economy back up across the state of Wisconsin. We and administration have heard that loud and clear. I'm in complete agreement that we need to have some semblance of hope for people. That is a large reason why we decided to open the golf course a week earlier than what the governor had laid out in, I believe it's Executive Order 28 through Secretary Designee Palm. There's no substantive difference between last Saturday and next week, Thursday, from a science perspective. We made that decision together. Kirsten, myself, and as well as the sheriff who's not here this morning. That wasn't made in isolation. The same thing is true with this plan. So there's a real need. I encourage people to exercise their First Amendment rights, to have protest if they so choose. What I do ask is, if and when that happens, and it should happen, but if and when it does happen, please follow social distancing, please follow the guidelines that are laid out. The big concern I have, I think, is the same concern we had on Election Day. And remember, we're the county that stood up and said, no, the election needs to happen. It wasn't that it shouldn't happen, it's that we can do this living with social distancing, living within the guidelines. Businesses can begin to plan for how they're going to operate in this environment. It's safe to do all those things. Americans have freedoms and rights that should be able to be exercised. And I think over the course of the last 6 weeks, they've done a pretty damn good job of showing we can do this. They've done a phenomenal job across the state of Wisconsin, we, the citizens of the state, to live within social distancing guidelines, to take seriously the pandemic, because the pandemic is serious. If you don't believe that, you don't have to really look very far. Brown County had a manufacturing facility, correct me if I go straight here, where they weren't following those guidelines. They've got dozens, if not into the hundreds now, of cases of COVID-19. That is exactly the wrong thing. We don't want that to happen. And so living within some guideline moving forward is important. But putting out a plan that says May 26th is the date and it's got to be a dialed up process, and yet there's no turning of a dial isn't acceptable either. So what this plan tries to do, attempts to do, is put the onus of responsibility on the individual, their individual liberty to do what they feel they need to do, and yet live within these guidelines at the same time. I think I saw an article this morning in the paper from Sheriff Schulteis. They're going around, they're not giving people tickets or citing them criminally. They're simply asking them to live within the guidelines when they're out in the park too close to one another. And it sounds to me like generally they're doing that. When I've talked to folks on the golf courses who own the golf courses this past weekend or operate the golf courses this past weekend, their tee times were packed, relatively speaking, packed for a pandemic, from early morning to evenings, Saturday and Sunday, and everybody was following guidelines. It can be accomplished. Washington County, Ozaki County can be an example, but we ask people, feel free to begin to do those things, businesses prepare to do them, but please live within the guidelines. The worst possible thing that could happen is we open too quickly, we see a surge in cases, and then we go back to some version of closure. We absolutely cannot have that. So we're trying to find a balance between public health and the economy and respecting everybody's constitutional freedoms and rights all at the same time. And that's undoubtedly a challenge. From everything from the businesses that were mentioned a moment ago who are mightily struggling, all the way to nursing homes where residents haven't been out of their rooms in weeks. There's a real consequence for mental health, both with regard to the economics as well as isolation of individuals. So there's no perfect solution. The government isn't going to solve this problem, but we're trying to give people the best guidance possible to mitigate it as best we can so that together we defeat it. The minute that individuals start ignoring the guidance is the minute we're all in trouble. So please, I'm sure there's questions in this audience. Kirsten's got one more comment and then we'll take those.
I just want to piggyback on that. So I think from the public health standpoint is that these guidelines in terms of physical distancing, wearing masks, absolutely need to be followed. We have capacity within our counties to follow up on outbreaks, 10, 15 a day, no problem. If we get to 50 of hundreds of people, we can't handle that. So our plea is to please, as business owners, manufacturing, work with us. Our goal here is to open up so that we can function as an economy, but do it safely. And if we have people who are pushing against us and just flagrantly disregarding the physical distancing measures, not wearing masks, not telling us and not being honest about who they were in contact with, it's a huge barrier, and we really risk the spread even more. And we fully anticipate that there's going to be a second peak. We know that's going to happen. Our hope is that it is something we can handle and get our arms around. And so all of this work is really to slow that peak and to make sure that we can handle it. Again, like I said, we have capacity to handle a significant surge, but if it gets to the point like what's happening in Brown County where there's 300 cases, over 120 in less than 48 hours, that is more than any public health department can handle independently. And we need to avoid that. And so my plea is we recognize and we're trying to weigh and measure all of this together, knowing that the economy is important, but our health is also important. Like I said, just please heed some of this work.
So there's a few questions. I just want to mention, we reiterate a couple of things. This is a Washington Ozaki specific plan. This team is contact tracing like no other team, arguably across the country, and I've been doing it for a very long time. And if you need anecdotal evidence of that, look at Village Commons. Village Point Commons in Grafton, where they had cases very early on inside of that facility, and the contact tracing that this team did literally stopped the spread in its tracks. It could have decimated that entire facility. It was significant, but it wasn't what it could have been. So that's one. Two, testing, all you're hearing on the news is this argument back and forth, left and right over testing. We need testing to be figured out. Pointing partisan fingers at one another is solving nothing. Just get the damn testing in place so that we can move forward. Testing needs to be able to happen so that we can track where those hotspots are, so that Kirsten and her team can go in and do contact tracing. The minute we aren't unable to do contact tracing, use an example of a county fair. You go to a county fair and there's 20,000 people there. How in the heck are they going to be able to monitor that? It's not possible.
And that's what this plan is based on, is as we open, every consideration is taken. Okay, if somebody goes into that business, and a person, anyone, can we figure out who they had contact with while they were in that business? How hard will that be? If it's gonna be really hard, like a county fair, well then we should consider not having that. If it's a bookstore and there were 5 people in there and they're keeping a log of the people who come in, well that's a different consideration. So that's how we're sort of weighing the risk and how quickly we can open things up.
Thank you.
Thank you.
And some questions. Supervisor, here, I'll come over there.
You mentioned a couple things. First of all, the numbers and then the testing. What is the current trend line in numbers in Washington County, and what is a timetable for the testing?
Sure, so the numbers are still going up. We're still gradually increasing. It's actually been fairly stagnant. So if you see early on, we had some days of 6 and 7 positive cases. On average now we're seeing 3, 4 a day. We've had a couple of days where we've had 1. So it's fluctuating. And the reason I think it's fluctuating is because we aren't testing. We are still only testing those same number of people. The piece that I think is most compelling, and I have this in the document that you will get today, is around April 2nd, when we started doing contact, prior to April 2nd, we would call a positive case and say, who are the people that live with you? Are any of them symptomatic? And pretty much unilaterally, they would say no. Starting around April 2nd, every contact that we call, every positive case we called and said, who are the people that live with you and are they symptomatic? The vast majority said yes, everyone is sick. So we saw at the beginning of April, we started to see that there were an increased number of cases, but we aren't testing those people. We're just presuming they are positive. And for us to really understand how this is spread, we need to be able to start testing.
Okay, a couple of comments here. First of all, I want to thank you for keeping our parks open. Thanks to Josh, Jamie, and Kirsten, or Kristen?
Yep.
Kirsten. So thank you for doing that. Thank you for getting the golf courses open right away. Those are activities people can do and maintain proper social distancing and be safe. I agree with the idea that Samaritan should be kept closed until we are absolutely certain that we have this speed, because that's a very vulnerable population. We don't want something like what happened at the facility in Grafton, whose name I forget. We don't want that to happen in Samaritan or other long-term care facilities in our county. One thing I have heard, and I've heard it from one of my constituents, but I'm also hearing it from a lot of other people who don't live in my district, is that there is a problem right now with healthcare access that is not COVID-19 related. If people need lab work done to find out if they have cancer, or if they need cancer treatments or rehab treatments, all of that is being canceled right now so that we can treat COVID-19 patients, but we're not getting the volume that we expected. So as a result, healthcare facilities right now, it sounds like, are actually furloughing employees. And so there's a real disconnect there. I don't know what, for our county, what influence we have to change that. But it seems like we need our healthcare system to be more adaptable, where they go back to doing these procedures, or at least tentatively scheduling them, knowing that they can cancel them if there is a sudden influx. But if there's no influx, then all these other healthcare needs need to continue to be met. They can't just be put on hold indefinitely. So what influence do we have with the hospitals in our county and all the medical facilities in our county to get those things happening again? Or am I getting misinformation from the people I'm hearing?
So I don't know specifically. I do know that they are providing some cancer treatments. I do know that there are some things proceeding. I know that elective surgeries, for example, have been canceled for a variety of reasons. But we also are part of a regional system of healthcare partners that meet frequently to talk about these things. I can certainly bring that information back to that group and tell them that it's a concern of our constituents.
Kirsten, you talked about the presumed cases. They don't fall into our stats though as positives at this point.
Cases?
The cases that are presumed?
Yes, so the presumptive positives are not counted. The only cases we count are if there's an
Actual
actual
test.
positive lab report.
Okay, just want to make that clear.
Yes.
Do we track presumptive positives or no?
What's that?
Do we track at all presumptive positives?
We don't, because we have no way of tracking them. That's one of the challenges, because people call telehealth. They'll say,
Okay.
yep, we're going to treat you as if you're positive for COVID-19. Unless they call us, we have no way of knowing. And unless they're directly a contact, so that's the other piece. So if we have a contact of a positive case that says that they're symptomatic, and as of last Friday, we are sending them to get tested. Prior to that, if they were a healthcare provider in any capacity or a first responder, we were getting them tested. But so if people tell us that they're symptomatic, we're making sure they get tested, and it's not just a presumptive positive. But like I said, when people call telehealth, we have no way of capturing that information.
Well, thank you. I took your message clearly.
Thank you.
I'm not here a little grandstanding, but if you're saying there's efficacy to it, okay, let's swear them then, right? My question is, symptomatically, we're making some assumptions, but it's the asymptomatics that are the biggest issue. So it's likely that many of us in this room right now are asymptomatic or possibly asymptomatic. But how do you control that? So the social distancing can help, but how do you address the asymptomatic?
So I think the masks are a way to address the asymptomatic cases. We have no way of knowing how many cases there are. So one of the numbers that came out early on, and we've been using that as a proxy, was for every positive case, and for every lab confirmed positive case, there are 10 other positive cases that have not been tested, which is still a really low number. So if you take that number for our 2 counties, it's less than 10% of our population. I hope that's inaccurate. I hope that we're at a higher level of exposure, that more people have been sick and have some immunity, but that's our best estimate. So you're absolutely right. I mean, so part of this is, the other piece is that the test, it's unclear, the science isn't there yet, if the tests are accurate if somebody's asymptomatic. So we don't know that information either. Again, part of this is it's new. It's the novel coronavirus. That's one of the challenges, is that we just don't have the research around it to know really what we're facing.
First of all, I'd like to lead this whole body in thanking you and Josh, Don, the whole team, because what you've done has been fantastic.
My team is fantastic.
And second, my question with the no symptoms business. I think there's conjecture that a lot of people have had it and never even knew they had it. Antibody testing, where is that going to happen? When is it going to happen? What are your thoughts on that?
So I believe there are 14, and I could be off on the number, but there are a number of antibody tests that are potentially available on the market. Again, the research isn't there that whether or not they're effective. The question we need to ask ourselves is if we want it to be effective, if we want it to be fast, what's most important to us. So if we want fast, it's there, but the question is it really going to tell us anything? So I have not been able to keep up with the science on that, but generally speaking, that's the consensus. They are doing studies across the country using various antibody tests to identify populations. I think if we look forward in a few months, that's gonna be a very important way for us to identify who's potentially had it and who hasn't, who has immunity and who doesn't. The other piece I think that we should consider, and this is beyond the scope of the work in our counties, but it's in the plan as well, is that there should be some sort of study done in Wisconsin, with a randomized controlled study of just identifying people in families and potentially getting them an antibody test to see how far it is spread and into what communities. But yeah, absolutely, that's considered something.
As a follow-up to that, like a lot of people, I'm getting calls from the blood bank every other day that they need blood. If I go give blood, are they testing?
That's a great question. I don't know, but I would say please give blood if you are able.
I'm going tomorrow. Doing right.
Pardon?
I'm going tomorrow.
Thank you.
Oh, thank you very much. I wanted to echo what Supervisor Schleich brought up in appreciating the efforts of our new city executive, excuse me, county executive, county sheriff, and yourself for doing what you do. But I mean, it's hard for me not to point out the fact that you mentioned twice about wearing masks, and you nodded like, yeah, I didn't have one. You should have one.
I should have one on, you're absolutely correct.
It's very critical to bring that up and sit there and do it. Now, until Supervisor Dallas finally put one on, during the second meeting, I'm the only elected official here bothered to wear it. This isn't for show. Okay, I very seriously consider being on the phone because, I've discussed with some of you, I'm not high risk of getting it, but I'm very high risk if I do get it. And those are the people, I believe, should be doing this and making sure that we're not doing, really what we're looking at is, and this is what I'm afraid of, looking at herd immunity, which is what we want, versus herd mentality, which is what I think that we're being pushed at, which is extraordinarily unfortunate. A couple of points. There are several dates, because dates have to do with businesses, and businesses have been put out of business for over a month now, and we're looking at going weeks further, and I hope your plan does more than that Badger plan that our current governor put out, because his doesn't have any dates, so it's meaningless. If you're a small business, we've already lost the Booster, our little newspaper here in Hartford, because of this pandemic. Why? Because over 70% of their income comes from businesses that are now closed, the restaurants, the bars, and that. So we felt it in Hartford, and I'm getting calls continuously as a mayor. What are you going to do? How are you going to do it? Why are we doing it the first time in history that is known of that we're quarantining everybody? We're quarantining people that aren't sick. We've never done that before. And when you look at, in fact, that study just came out. It was Stanford University, the Santa Barbara study, was just put out this past Friday. I'm sure you've probably heard of it. That they did some antibody testing and spread it out and look, okay, they've got 1,000 cases in that area. But when they did the antibody test and they worked out the numbers, they figured that the actual number that has been exposed and has antibodies is 50 to 85 times higher. To give you an idea of the ridiculous. Most of these people asymptomatic. So we're handicapping ourselves to a degree. Realize this is most likely going to come back. If it dampens down in November, December, it's going to come back. What are we going to do? Do this again? And I'm a person at risk. If something happens to me, this could really take me down. But what are we willing to do? We're sitting here with this herd mentality of, yeah, we're just going to go along with what's going on. It's not enough. It's too timid as far as how we're moving this forward. I honestly believe that individual responsibility goes along with the freedom that we need, and there has been an exposure rate that continues. You can practice a lot of what you have mentioned before, and not necessarily worry about having this incredible surge. We know as testing increases, we know the numbers are going to go up. Why? Because people who don't know that they have it are going to turn out that they have it. You know how many confirmed cases we have in Hartford right now? 9. You know how many beds in our hospital? I built this big fancy white tent and put all this equipment in. You know how many people, COVID cases we have in our hospital right now? 0. But, like was mentioned before, they're canceling non-elective. Anything that has to do, or that doesn't have to do with COVID is getting pushed aside. This is what we're doing to our society. We're killing our small businesses. Rather than having it where we open them up, social distancing right now. If you got a little Christian bookstore or something, and you only let 2 or 3 people in at a time, that can literally save that business. Versus what we're doing right now is say, oh no, you can't do that. That's not essential. Who says it's not essential? You know, if you're a spiritual person, maybe it is essential. The fact that we're letting that go and having people that are, who could be following a political agenda, which is what's essential and not essential. Look at, I think it was the Bill Bright story. If you've been following this, I've been reading and going through everything that I can every single day and on webinars and calls, as many of you are. And we look at the Bill Bright. Here you've got a company that builds things for people that if you all of a sudden are homeschooling and you don't have any stuff, you don't have any desks, you don't have any of that, what do? Well, you're going to go to a furniture store, but a furniture store is not essential. So Bill Bright gets screwed into the ground, you know, people that are building it here, but you can go to Walmart and buy your Chinese-built furniture. Why is that fair? That's ridiculous. But that's what's happening. All of the guys are, well, we got to be safe. Why don't we let a little bit of individual responsibility? If you're over 60 years old, all of you should be wearing a mask. You choose not to, that's your individual responsibility. We've got over 40 people in this room right now. And great, we're 6 feet apart, but that's what, now can we do it legally? Yes, because we're given an exemption based on the fact that we are a government entity. But you're putting yourselves at risk. And you choose to, because that's your choice. You don't want to be seen on camera with a mask, whatever it is, I'm not sure what it is. But I'm frustrated because I'm sure that there are some of you, by your age or by your stature, are probably at least as much at risk as I am. And if you want to take that, that is your choice. I don't know how many of you are out of a job right now, but I got a call from a lot of you. You have 16,000 people in your city, and you take 1% of it, that's 160 people. And believe me, they keep calling me and saying, why is my job unessential? Why can't I do this? If I take personal responsibility, yet we still, you know, it's kind of crazy when you think, I can't take a golf cart on a golf thing, but I can take a shopping cart at Walmart. Why is that? Why can't I do it if you only put one person in a cart? That wasn't addressed. See, this is some of the craziness and the arbitrary decisions that are being made. I would ask that our sheriff follow what Christopher Schmaley did in Racine, God bless him, that just says, look, we're here to do the traffic stuff, we're here to make sure that criminality doesn't spread in our county, and we're going to let the state follow through on enforcing this and step back. That's what I would like to see. I would hope that, and we're not getting a vote on this apparently, this is just going to move forward, but I sure would like to see it, because it makes a lot of sense. Thank you. Not that I have an opinion.
First time.
Thank you. Okay, first of all, Mr. Mahalik, well said. Thank you for that. And it leads right into what I want to say. First of all, thank you and your team. Great job. To me, part of it is information and an actual sense of guidance. And I think that's what Mr. Mahalik is alluding to, that we haven't gotten proper guidance. And specifically, churches. To be honest, I appreciate the science. I get it. I follow it. But my spiritual health is a lot more important to me than my bodily health. And that's the way it is with a lot of people in this room. So my church has said, we're going to honor all this, and I'm good with that. But then you look at what happened with Evers and the parking lot masses. I think a lot of that was really misdirected. It shouldn't have happened. So we should use that as a learning opportunity. Let's not do arbitrary stuff, and let's try and get the information out there. We as Christians also have a responsibility not to harm you. Okay, so I can understand if you tell me this is going to harm it, but there is no harm, obviously, in staying in a parked car. So let's not be arbitrary. Let's make sure we're being clear in our direction. In regards to the folks over in nursing homes stuck in their room, I have been approached on this, and I think we absolutely have to make it a priority to get them out into the sun, if not even only for an hour or something. There is a way, and it absolutely has to be a priority. The mental health of these people and their ages, I mean, I'm sure a lot of them are suffering from dementia or Alzheimer's or whatnot, and being stuck in four walls. I mean, that is solitary confinement. I mean, that is, you just can't do that to people. We're seeing an uptick In my business, I'm in the funeral business, and we're hearing that old people are giving up, that we've had a rash of deaths that for no other reason, people are just deciding that they're just checking out. And it's the stress that's brought on by this. It's the isolation, the loneliness. This is part of the spiritual health that I'm talking about. So it's very important that we make that a priority. And as far as the hospitals, I also would concur with what Mr. Foster said. Mammograms, pap smears, colon screening, blood tests, all these things are not being done. We were told these things for the last 20 years, how important it is to get all these screening done and go in and get your physical exams every year, and all that stuff's been put on the side. It makes me wonder just how many people are gonna die from being undiagnosed with these types of illnesses, cancers that go unchecked. And they're saying elective surgeries, but to somebody whose knee is blown out and they can't get it repaired, it's not a matter of being like elective, like I'm getting, you know, a facelift or a nose job. I mean, now this person is hobbled and can't move, or back surgeries, all those types of things. So if we have any pull with hospitals, I think we really should find a way to make them a priority towards getting back, especially the screening. You know, things like blood tests and things like that. I think it absolutely is necessary. Also, logging people. I think that's a great idea. I have a hairstylist, had her for, I know, I do. I've had her for 8 years, and she's a single mom. And right now, she has absolutely zero income. And what do you do when you can't pay your rent, you can't pay your electric bill, you can't eat? I mean, sure, you can get assistance, and it takes forever, and, you know, I mean, she made a pretty good living because she's very popular as a stylist. But I think if she can log people in, get names, and she knows all of her customers, she has regular people, she should be able to start back up again. You know, 1 or 2 people in the shop at a time, log in their names, disinfect between people. I'm sure she would rather have some income coming in than no income coming in. And I think those are the types of opportunities we should be looking for in our small businesses. You know, obviously restaurants have been able to do takeout and stuff like that. So they found a way to do it. Let's try and work with some of these other small businesses and get them to be able to open up and start earning a living again too. So that's all I have. Thank you very much for your time.
Anything else back there?
Well, gang, how does it feel to live in a Bernie Sanders world? Socialized government, they tell you what to do. Here's the bad part, I was at a meeting, a teleconference meeting a couple of days ago.
Pete, pull it a little away from your mouth so it doesn't.
Oh, I want to make sure you heard me, because I did like your speech. Now I'm going to say I don't like your speech.
No, just pull it away from
Okay,
the
number one, the Chinese have brought this world to its knees without firing one shot. That's sticking in your head? Okay, that's how I wanted to say that I've been thinking about. Number one, we're not California, we're not New York, we're not Chicago, or Wisconsin, okay? I don't want to brag on my friend Bill, who has a small business there, but people are starving, okay? Small businesses starving. We need to forget the baloney. I'll tell you what, you're going to be first one to get on an airplane to Las Vegas? I guarantee you're going to hesitate to go to Hawaii because of the fear of God that they put in you, all right? We're Wisconsin, we know we're going to be careful. Well, if it goes on 14, forget the 14 days. You go out, you're not going to mingle with somebody already because you're already dealing with it. But Wisconsin needs to ease up. We need to let these people open their businesses up again. I guarantee you there's not one person in this world, in this room, or in Wisconsin that's going to keep doing this. I mean, we understand it, it's in our head. But we got to start living again. People are starving. Should we be careful? Absolutely. Absolutely. But it's not like, well, it's going to, May 26th, goes. It's easy for him to say May 26th. Simple. But look at the guy in the streets not working. 16.8 million people at work. That's not funny. Okay? You got a family, you got kids. You know, it doesn't work. I don't wanna, blow hard and scream on it, but this is true. Wisconsin's got to open up. Because we are not that bad. We have problems? Yes, we do, but we're not that bad. Thank you.
Turn.
Did I miss something?
Yeah, Randy had his hand up
Oh,
before.
I'm sorry,
You can be next.
Could you review the 4 points that you referenced in the beginning for when you would?
Sure, and I will also tell you what Governor Evert's plan says in it. So the 4 points are 14 days of continuous decrease or downward trend in statewide case counts and a decrease in hospitalizations. Hospital capacity and operations back to near normal, like I said, we're there. Enough testing capacity to test everyone. And capacity to do contact tracing or active monitoring on everyone. So we have that as well.
Thank you. The concern I have is, in the beginning, we were told we need to bend a curve. The first point that you listed off there to me sounds like we have to have a flat, or a straight line negatively before this is going to ease up. I think that the people that I represent, we already feel like we've bent the curve. The hospitals are empty at this point. Now we're being punished. Maybe that's emotion, not science, but we've bent the curve already. And so I would hope that we could re-examine the need to have the 2-week decline in cases, because as income's available, it's going to be a long time before the registered cases are actually declining. So, thank you.
So we had a long discussion about that. I'm going to just address a couple of things. We had a long discussion about testing. There's a reason that the order says, and I think the Badger bounce back plan or whatever it is, references testing only. You'll notice that hospitalizations are also talked about in our plan or referenced in our plan. The reason for that is we know exactly what you're saying, that it's inevitable. You test more people, you're going to get more results. There's going to be a spike. At the same time, hospitalizations, as long as we keep counting hospitalizations, we're going to see a correlating nature then. So the hospitalization number will tie to the testing number rather than allowing testing only to dictate. Because you know you're setting yourself up for failure. That goes to exactly why dates are useless. Putting a date out, May 26th or May 11th or June 24th means nothing. To say that we should use dates because it's going to give us some sense of normalcy. What gives you some sense of normalcy is knowing that data is driving decisions. That's what people want, hold. And that's what this plan is intended to do. When we see that it's worked in full and we're to a point where we can safely go back, I mean, that's what you're seeing in surveys over and over and over, is that's what people want, is to know that they're safe when they go back. So both dates and trying to tie it simply to tests don't work. And that's why this plan is different than the governor's plan, in part.
Thanks, Josh. I appreciate all the opinions around here. I agree with almost all of them. I wanted to get back to, again, put it in your hands as the expert here. The idea of cloth masks being for protective equipment is kind of a fallacy. My understanding is that the reason we are recommending doing that going out is, again, to prevent the spread from you to others. It's not, this isn't an airborne virus, so it's not being inhaled. So the idea is to limit the amount that you might be spreading being possibly asymptomatic. And it also aids in the fact that as you touch things, and the one excellent video that I saw from a New York doctor was, know where your hands have been and make sure they don't go to your face. So the mask on your face is a good reminder to not touch your nose, your mouth, your eyes, those kinds of things. So it's really when you're out and about that you're not possibly spreading this to others and putting it on surfaces that you come in contact with. So-
Exactly, thank you for bringing that up.
Yeah,
Yes.
so-
It is, and cloth masks, there's been research, so early on our website, we put something out, because there was a push on social media about making cloth face masks to send to hospitals. Cloth masks are not effective PPE in a hospital setting. They are not effective for healthcare workers. They are simply a mechanism within communities to potentially stop the spread at a community level, not within the healthcare system. So thank you for bringing that up.
Kirsten, my wife probably is not going to like me talking about this, but so it's not an anecdotal evidence of lack of care coming out. The Germantown Clinic, my wife goes, we both go there. She had a bladder infection, asked if she could just come up, pick up a sample jar, give a sample, and leave, and then they could, prescribe whatever, because bladder infections have different causes. They would not allow her to come in. They said, I'm going to talk to you about your symptoms, and we'll try this first. And, some of the treatments have worse, there's worse things that happen to you if you take the wrong medication. So it is getting pervasive that the medical profession is really pushing off pretty much everybody. I had my physical done remotely, and I have skin cancer in my family. I have to have that checked every year, and there's no way to check it until we go again. So I'm going to be going probably about around 18 months before I actually get a check. And in 6 months, a lot can happen with your skin. So I don't know how we reach out to our medical providers to.
I can bring this forward to the healthcare partner group. And I certainly can't speak on behalf of our healthcare partners, but I can say the other piece of this is that they are trying to protect themselves as well. Because if there is a situation where a healthcare worker becomes ill and potentially spreads it among other healthcare workers, we could effectively shut down clinics and hospitals.
Right, that's correct, yeah.
And without knowing exactly what's going to happen.
Yeah, but I think there could be some way to mitigate. I mean, we like it was said before, we do curbside service for takeout. Can we do curbside service for? All right, I'm going to send a urine sample. Have it out. And, I mean, it used to be you'd go into the bathroom anyhow and put it through it wouldn't touch anybody. It goes through a little door. So I mean, can they do something like that? I mean, because granted, a bladder infection isn't the biggest thing in the world, but it can become much worse. So, thank you.
Okay, couple points. So obviously our plan is going to be different than Milwaukee County. Milwaukee County has about 2,200 cases right now. Our county has less than 100, so that makes sense. When I look at our county data, I look at Newburgh and they have 1 case. I look at Allenton and they have 0 cases. I look at Richfield, they have 0 cases. And then I look at West Bend and I think they were around 30, 35 last time I looked. Is there some thought to those communities where they don't have any cases yet, letting them open up sooner than a West Bend? Is that at all being looked at?
No, that's a good question. I think that the representation of this spread within our communities is indicative of not necessarily, it's more of a reflection of our population. So there's a larger population in West Bend than there is in Allenton. Honestly, I think that's, in Richfield. There are likely cases in those places, they just have not been tested. So we can't say, yes, Richfield's safe, West Bend isn't. We can't say that, because it's quite likely, in fact, I'm sure, there are cases in Richfield and Allenton that just have not been tested. Again, so it's really just a reflection of the population.
Okay, and you mentioned the 14 days of declining cases. Now, when we have small caseloads daily of 4 and 5, one of the rules with small numbers is there can be high variability. So if we have declining cases, and one day we have 2, and then all of a sudden the next day we have 3, Does that start that 14-day clock
No.
over?
So we had a long conversation about this too. It's the general downward trend. And the other piece is adding the hospitalizations, because as Josh said, I think the hospitalizations are more indicative of where we are, simply because the hospitalizations aren't going to change in the next month if everyone continues to stay at home. I think that's a better number than the total number of cases, because it's not a reflection of who's being tested, those are a reflection of who's actually critically sick.
And how many people are in a hospital in Washington County right now for COVID-19?
I don't know, as of last week, I think we had a total of 36 at one point, and that's for both counties. And I should say that my understanding is Hartford Hospital is not taking COVID-19 patients, they're all going to Grafton. So, and that's the other piece, we have three separate hospital systems that operate within our borders. And some have more capacity than others, so it's not necessarily an accurate reflection of, but as of, I know at one point we had 24.
Okay, and then what is the efficacy of, we hear on the media a lot about how we as a society need to develop herd immunity, where a significant number of us have antibodies, so the disease has nobody to spread to. What's the efficacy? Have they studied this concept of herd immunity with this disease yet?
So herd immunity is just a concept that is run for all diseases. It's the same concept, for example, measles, mumps, all of the diseases that we have vaccine for, the flu, essentially. The idea is that when we have herd immunity, people are less likely to become infected. One of the issues, for example, with whooping cough, I don't know if anyone follows disease patterns, but whooping cough, for example, has made a resurgence in the United States because we have gone below the threshold of herd immunity for whooping cough. It's particularly dangerous for young children, infants, but we have seen now we are below herd immunity because people just haven't been getting vaccinated. And there was a point in time when the vaccine potentially wasn't as effective, so it didn't last as long as we thought it did. So we see spikes in late middle school students. So that's a concept that across disease since we started thinking about immunology. Yeah. But it is something that we need to consider, and I think that the herd immunity piece is particularly important when we think about the most vulnerable populations. So those people who are older and have underlying health conditions, they're at highest risk. And so unless we have herd immunity, the restrictions on that population in particular is probably going to remain the most strict because we want to protect them for as long as we can or until we have a vaccine available.
Well, thank you for all the questions. A little bit later this morning, we're already a little past what we thought we would be. We're going to do something similar for the press. Both myself and Kirsten, and we're inviting the sheriff to be part of that. I just want to say that I know this is extremely frustrating time for a lot of people, being some who are literally cooped up in one room, others just not being able to go out and do normal things. That being said, the intent of this plan is really to try and help thread a needle. For all the talk about let's just flip a switch and let everybody go back to doing what they're doing, look, the President of the United States put out a plan that isn't all that far off from what this plan is. The President is acknowledging, the President started everything off on the right foot. Safer at Home has worked, there's no doubt about it, and we've lived under it, and I think for the most part, Wisconsinites have done a great job. Now, the governor puts out a plan with an arbitrary date that has no metrics tied to it, tries to tie some yesterday, I guess. This plan is trying to thread a needle between the two and something that can work and work locally. We urge our partners across counties all across the state of Wisconsin to do something similar, because I know for a fact, friends of mine up in Chippewa County and Eau Claire County have stories of one case in the entire county. It's a totally different ballgame up there. Kewaunee County, my home county, where I was at high school living, they have just had their first case last week. So it's completely different for them. But this is intended to thread a needle between the president's plan, which is very generic across the entire country, and everybody knows state by state it's different, and the governor's plan, which is locking down an entire state, carte blanche, blanket approach, and instead saying, we've got we've got a handle on things. You just heard we have 2 out of our 4 criteria are already met. So the minute, our intent, my intent, is the minute that we get to achieving the other 2, that we begin to talk about how are these other things beginning to open. If we live under the order as it exists now, that's extraordinarily difficult. We need to have flexibility, we need to give people hope, and that's what we're trying to accomplish with this plan. So, Mr. Chairman, thank you for the opportunity with the county executive's report, and I defer back to you.
Okay, seeing that there's no other business, we stand adjourned. Thank you.